Do regional variations affect HMO versus PPO health plan costs? Imagine trying to buy a car and finding out the price varies wildly depending on where you live. The same thing happens with health insurance plans like health maintenance organizations and preferred provider organizations. Yes, where you live can change how much you pay for these plans. These differences come from how many doctors and hospitals are available nearby, what local medical services cost, and how many insurance companies are competing in your area. Let's look at the basics first. Health maintenance organization plans usually have lower monthly premiums and lower out-of-pocket costs. They requiring you to pick a primary care doctor who manages your care and gives referrals to specialists. You mostly need to stay within their network, except for emergencies. This limited network helps keep costs down but means less choice. Preferred provider organization plans give you more freedom. You can see specialists and out-of-network doctors without referrals, but this flexibility comes with higher premiums and out-of-pocket expenses. They tend to have larger networks, especially in cities, but might be narrower in rural areas. Now, how do regional differences come into play? In some regions, health maintenance organization plans might have smaller networks because fewer doctors participate. This can make it harder to find a doctor nearby, which might push you toward a preferred provider organization plan for better access. In urban areas with many providers, PPO networks are usually broader, making it easier to see the doctors you want. But in rural regions, PPO networks might be smaller, which can limit your choices and increase costs. Medical costs also vary by location. Places with higher hospital and specialist fees tend to have higher insurance premiums for both types of plans. If you live in a city with expensive healthcare services, your premiums might be higher whether you choose an HMO or a PPO. Since preferred provider organization plans allow out-of-network care, their premiums could be especially high in these areas. Insurance market competition is another factor. If many insurers operate in your region, premiums tend to be lower because of competition. But if only a few companies offer plans, prices might go up. State regulations also influence costs. Some states have rules that requiring insurance companies to keep networks large and accessible, which can increase premiums. Others might have fewer rules, leading to more limited networks and potentially lower costs. For Black communities and anyone looking for affordable health coverage, understanding these regional differences is key. If your area has strong, well-established health maintenance organization networks, they might be a good choice for lower costs. But if those networks are limited, a preferred provider organization could give you better access to the doctors you need, even if it costs a bit more. Comparing plans carefully by looking at premiums, provider options, and out-of-pocket costs will help you find the best fit. Remember, out-of-network options are more available with preferred provider organization plans, which can be helpful if your preferred doctors are not in network locally. But keep in mind, this flexibility usually means higher costs. If you have ongoing health needs or see specialists often, the extra expense of a preferred provider organization might be worth it for the convenience and access. In the end, regional differences do influence the costs and choices of HMO and PPO plans. Knowing what's available in your area and weighing the costs against your health needs can help you make smarter decisions. Take the time to research local options, compare plans, and choose what works best for your health and your budget. That way, you can get the coverage you need without overspending.